Dr. Asmita, what is one common complication that you're seeing during pregnancy these days?
Okay, so maybe gestational diabetes. It is so common that we don't even consider it a complication anymore unless the woman is requiring maybe insulin. So mild derangement of sugars, and which can be controlled by nutrition and exercise, is very, very common these days. And the reasons may be because of pre-existing PCO or pre-existing overweight, and a lot of high carb diet, which is common in our country. So that could be the reasons, but I see a lot of women with that.
Women having that. Would age also be a factor there?
Age is again very important factor because women are getting pregnant later in life, and diabetes is a disease which is affecting around 40s, and if we are getting women who are pregnant at 35 and 38, they are more prone to diabetes.
Right.
And pregnancy itself is a diabetogenic condition. It sort of triggers diabetes.
Yeah, it puts a pressure on a lot of systems in your body, and that's the reason why. So, according to you, like once a woman is pregnant, how important is nutrition during pregnancy, throughout the 9 months of pregnancy and even post-delivery?
So, if mother is having good food and mother's nutrition is taken care of, then only the child is going to be healthy. And we are talking of an entire generation. The next generation will be healthy if we are having good nutrition for the mothers. And this is seen. Maybe say 40-50 years back, the entire generation was slightly weaker, slightly shorter. Nowadays we see kids with good heights. That is because of improved nutrition during pregnancy.
Correct.
Nutrition of the mother. So it is very, very important. Also, there is this theory which says that intrauterine nutrition has implications on adult diseases.
So true.
So intrauterine growth restriction will be linked to diabetes later in life. So a child who is not getting proper nutrition inside the mother's womb will have diseases later. Correct. So it is important for both for the mother and for the baby also.
Yeah, and one thing is, nature has adjusted the thing in such a way where the nutrition goes to the fetus first.
Yes.
And then, the mother is then going to be devoid of the nutrition, which is going to be very essential later on in life. Because then we start seeing like old age, then the chances of fracture increases on all these things, So to avoid that, I think first take care of yourself and then you will be able to nourish the fetus better.
Right.
And how about post-delivery? Because, women take care of themselves very well in these 9 months and then they just forget about everything once the childbirth happens.
Right. So I think post-delivery nutrition is even more important than during pregnancy, because during pregnancy we are having a small little grain sized thing which is going to grow to around 2.5 to 3 kg. But post-delivery, a 3 kg baby is totally dependent on the mother for breastfeeding. And we have so many myths around here that don't eat this, don't eat that. So poor mother is deprived of the basic nutrition during breastfeeding. So it is important that first the myths are broken. A lot of women are getting only churun bhakri and methi ki sabji and nothing else. And it is impossible to eat this for 3 to 6 months. Some traditions are there that they don't put salt at all during breastfeeding. So these things have to be addressed, and after delivery, it shouldn't be only the baby is in focus. The mother has to be in focus. Otherwise, the milk quality is also going to get affected.
Correct.
And like you said, after say in old age, fractures, because they are not taking supplements. During 9 months, everyone is very, very careful about taking all the supplements. During breastfeeding, I always ask them after 2 months or 3 months of follow-up, are you taking supplements? I forget, doctor.
They forget.
There is no time. Baby doesn't allow me. Baby doesn't sleep. So there has to be someone who is taking care of the mother. If the mother is taking care of the baby, someone has to take care of the mother.
Final question to you is, as a nutritionist, we really promote breastfeeding because we know the benefits of breastfeeding both to the mother as well as the child. Right. So, from a gynecologist point of view, can you help the viewers understand a little bit more about this?
So even we promote breastfeeding a lot. I think it is the most important food for the baby. No formula feed and exclusive breastfeed should be promoted for at least 6 months. But it becomes difficult for the mothers. A lot of time the milk is inadequate, and that is why they are giving. But if formula they are giving because they feel that the milk is inadequate, but actually the milk is not inadequate. It is just that mothers are always apprehensive whether they are having enough breast milk. So there are certain criteria. We have to see if the baby is gaining weight. We have to see if the baby is passing urine, whether the baby is not having any jaundice, and then we know that the milk is enough. So promoting that is important, and at the same time having good nutrition, making sure that the mother is well rested, well taken care of, so that she is, she should breastfeed, and probably then baby should be taken care by someone else. The burping part can be of someone else, and she should be given very good nutrition. That is very, very important, because otherwise she is going to feel drained, and if she feels drained, you cannot give from an empty jar.
Yes, that's